My name is Christina Hildebrand. I am the president and founder of A Voice for Choice Advocacy. We educate and advocate for informed choice and transparency of what goes into your body. So be that food, air, pharmaceuticals, water, whatever it is, we want you to know what's in the product, and therefore you decide sort of the risk-benefit analysis of whether you take that in or not. We don't go one way or another. We just want there to be choice. So, if you go to Burger King and want to eat a Burger King, great. Just know what's in it and make that informed decision. Same thing with vaccines, same thing with all other products. If I don't get to any questions this evening, don't worry, we're going to do another one of these. It's clearly there's a need for them with all the people that registered. So the first question I see asks, it's a number of questions, it's 8 questions. And so it says, do the COVID vaccines contain heavy metals? I'm going to go through each of these. It's all about different things of the COVID vaccines. And so I'm going to answer as well as I know. I should also put a disclaimer in here. I'm not a lawyer. I'm not a doctor. I do huge amounts of research, reading, watching podcasts from all sides. I make sure that I actually read both the pro and the con side of everything that we research. So the first question, do COVID vaccines contain heavy metals? So the current ones, the 2 mRNA vaccines, do not contain heavy metals. We don't know, there are 4 or 5, actually there are 200 in production, but of the ones that are the leading ones, the Pfizer, Moderna, AstraZeneca, and J&J, I don't believe any of them have heavy metals. The J&J may, but I haven't looked into that. Then what are the dangers in an RNA vaccine? So an mRNA vaccine, these are the 2 that have been approved under emergency use authorization. They are the Moderna and the Pfizer vaccine. The real answer is we don't know what the dangers are of these mRNA vaccines, the full dangers, because they haven't been studied. This is a novel technology. It's never been used before on humans. It's never been FDA approved before. And so we really don't know what the long-term effects of these vaccines are. mRNA works on replication. So, in listening to some of the government hearings on these vaccines, for example, because it works on replication, there were concerns about pregnant women taking the mRNA vaccines because as the fetal cells are replicating, what happens to the mRNA, the genetic cells of the fetus. So there are questions, but the real answer is we don't know what the long-term dangers of these vaccines are because they've never gotten this far in clinical trials or in we're not even in clinical trials. We're really in a human experiment at this point, which is, anyone who's getting the COVID vaccine right now is in what's similar to a clinical trial because they haven't been completed. Do the COVID vaccines contain glyphosate? That is unknown. My guess is the J&J one may, because my belief is that it is made with some form of animal protein. And actually the adrenovirus also may be, although that's a monkey virus. So the AstraZeneca one may also. The glyphosate gets into vaccines. It's been found in some vaccines. The MMR vaccine has the most, but it has been found in vaccines because of the animal protein. So the animals eat GMO glyphosate-laden food, and then it gets into the serum, the blood, or the egg, or whatever it is, and then it gets into the vaccines. It's not removed from the vaccines, so it's not clear that no tests have been done on the COVID vaccines whether they contain glyphosate or not. The next question is, why are there 2 doses? So the second dose is a booster dose. There is not any information that I've been able to find, and it's a question that came up in both emergency use authorization FDA hearings of how much efficacy the first dose has. So a first dose usually primes your system. It usually gets it going, but you need a second dose to actually sort of make you have enough antibodies to fight the disease when it comes along and when your body meets that disease. So there are some vaccines that have more than 2 doses. For example, the DTaP, the diphtheria, tetanus, and pertussis vaccine, you get 5 doses of that as a child. The MMR vaccine has 2 doses. Interestingly, the MMR vaccine, the second dose only is for people who didn't react to the first dose. So 95% of people react and get antibodies from the first dose of the MMR. And the 5% is why the second dose is applied. And rather than do titer testing, which is antibody testing, the pharmaceutical industry has decided that you just get the second dose, even though it's really only 5% of people that need that second dose, at least in the time span that the first dose is given. It does wane after 10 years or so. So it would actually be better to have the second dose later if you're going down that road. Okay, the next question is, will it be required for state and community colleges and schools in general? So the COVID vaccine, we don't have a mandate right now. I think it would be incredibly hard for the mandate to happen when it's under emergency use authorization and when the FDA has not approved this vaccine. Do I see it coming in the future? Possibly. I think it really depends on what happens in the next year for these vaccines or for the disease itself, and whether it goes away, whether it mutates, whether it becomes something like the flu or whether it is a one-off like MERS or something like that. Will it be required for airline and interstate and international travel? So the difference, I should also clarify, there's a difference between federal and state mandates. So for example, schools, by state law, you have to get vaccinated. Some states have exemptions, various exemptions, but will it be required for things like going in grocery stores, shopping, those types of things? That's what I call a societal mandate. It's what's happened with masking, right? You can't go into a store without a mask. You can't go into an airline on a plane without a mask. I still think it will be hard for them to, in the next year, mandate the vaccine because of distribution issues, because of there will be, we've already seen there are vaccine reactions. So I think it will be less so than the masks, but there's a YouTube video that I did, if you go to the A Voice for Choice YouTube channel, that I did in July talking about societal mandates. I think it also comes down to how many people are going to refuse this vaccine. I mean, if people ask me what to do, talk to people, because it's only when a large number of people stop and say no, that we actually can get somewhere with saying no to airlines and things like that. And next question, can someone who's vaccinated for COVID still spread COVID? So this is not answered fully, but the thought is yes, that they can still transmit COVID. So they may not have symptoms, they may have much lesser symptoms, but they can still transmit it. We see that with the pertussis vaccine as well. And then also the last question on this set of questions is COVID really any different from the flu, or is it just the flu? So it's a different virus. It's really hard to tell what the real numbers are because there are so many places where the numbers are incorrect and not being counted in a way that we would normally count. So for example, COVID testing, we never before this tested asymptomatic people, even with the flu. Even if you had flu symptoms, you didn't always get tested for the flu. It was only once you entered hospital that you may get, or if your doctor said go get tested for the flu, that you actually did. That's an issue. There's an issue with, the deaths are with COVID rather than from COVID. And so those deaths are, overstated. There's a lot going on. The PCR tests aren't accurate because many of them are done at too high a cycle and just are getting a lot of false positives. So there's a lot there that we don't know. Questions. Next question. I'm going to go with the order that I've got them in. I think they're the order that they were put in, but they're also the ones that get upvoted. So if you see a question that you want, please do put a thumbs up on it, and then it comes to the top of the list. So the next one is, hello, I would like to know how to proceed with a medical exemption. I am a Christian Scientist and do not take vaccines, but I am worried my job will retaliate or do something if I don't take the vaccine. I also live in California and I'm worried about my 4-year-old daughter not being able to go to school without taking this vaccine. I want a medical exemption for her. Please let me know where to go. So I know there are people here from different states. I'm going to address the employee piece of it, and this is just general, and then I'll address the school because that's slightly different. So as an employee, The mandate, if your employer comes to you and says you need to be vaccinated for the COVID vaccine, there are two options that you have. One of them is a medical exemption. And for that, you need a doctor to say that you have some reaction to vaccines. And there's a medical reason for you to do that. Unfortunately, there are very few doctors that are willing to write medical exemptions in any state, but especially in California, because they've been witch hunted through the school issue, and they're being brought before the medical board for lack of standard of care. The other option, which I actually would go with more over the medical exemption, is a religious exemption. So under federal law, under the Civil Rights Act, you cannot be discriminated against if you have a sincere religious belief that you should not be vaccinated. You don't have to be part of an organized religion, so you don't have to be Catholic, Jewish, whatever it is, but you do have to have a sincere belief, and your employer can ask you to explain that sincere belief. So, they can ask questions about this to determine that you do have a sincere religious belief. The people say, well, can you write me a letter? Do you have a letter? Do you have a form? We don't give out a form of Voice for Choice advocacy. There are some on the web that you can find, but this is really a personal issue. I mean, your religion is your personal, is personal to you. And, even if you say you're a Catholic, your beliefs may be different from the next person's Catholic beliefs. The overall arching obviously is Catholicism, but your personal, how you interact with that religion is, or your religion, your spirituality. Religion is different from personal beliefs or ethical beliefs. So if you just say, I don't want vaccines in my body, that's not a religious belief. There has to be a higher power that is, instructing you basically that you don't want vaccines in you, or you don't want a certain ingredient. So another thing to be clear about, the two mRNA vaccines do not have aborted fetal cells in them. They don't use that. The J&J vaccine does, but you can't use the excuse of aborted fetal cells other than for live vaccines. So for the MMR vaccine, the varicella vaccine, the shingles vaccine are the only ones that aborted fetal cells apply to. I will say, we are happy. You can send me an email. I'm happy to help you with crafting a religious, not crafting, but, sort of solidifying your religious exemption, because it's not as easy as just saying, I have sincere religious beliefs, I shouldn't be vaccinated. You will be asked more than that. So that's my recommendation. And I say that because if you are religious in any way, I say that to use that because that is under federal law, and the EEOC, the Equal Employment Opportunity Commission, just came out with a statement saying, yes, employers can require a vaccine, the COVID vaccine or the flu vaccine, but they have to allow for medical, disability, and religious exemptions. Medical and disability are kind of the same thing, because there's not really a reason other than medical issues that you would get a disability accommodation. The other thing with a religious exemption is you can't be discriminated against. So they can request you make other accommodations. So for example, if you don't get the vaccine, that you wear a mask. Most of us are already wearing masks if you're in that type of environment, but they can require you to have other accommodations. So wearing a mask, not working from home if you can work from home, those types of things. But they can't discriminate against you. So they can't fire you, for example, for having religious beliefs. If you have a medical exemption, you don't hold that same discrimination ground. So that's why I say, if you're going to choose an exemption, the religious exemption, also because it's a federal exemption. So federal law trumps state law. So even if your state has something different, your religious exemption for employees, I'm talking about nothing else, for employees, trumps that. So that's what I would do for that. As for kids and schools, I don't think, so the COVID vaccine will not be mandated for schools in the next year. They haven't even put anything below 15-year-olds in clinical trials. So it has to be put through clinical trials. Now, your 16, 17-year-old, the FDA has approved that. ACIP added it to the adolescent schedule as being recommended. So if your 15, 16-year-old is working, then the religious exemption applies. But I don't think schools anywhere in the country I don't see them mandating it until at least 2022, because they have to put children in clinical trials before they can authorize the vaccine. So I think, I'm going to push that question off. So going on to the next question. Ooh, put that it's answered. Okay. I answered the question on can employers mandate vaccines. So can we get a transcript? Yes, there will be a transcript of this, and we will also be putting out the recording for everyone. I just wanted to keep it to our email list for people that are available to sort of register for it. Next question. I'm curious to know if there will be any sanctuary locations if the COVID vaccine becomes mandatory. I think we have to create those if we want that to happen. Right now, there is enough question about the COVID vaccine and enough hesitancy from outside of our group, our vaccine movement, that I think making it mandatory will actually backfire more. And if they do make it mandatory, I think there is going to be a huge uproar because people are not ready. I think if they make it mandatory, I think my guess is it will be in another year or so. I don't think it'll be mandatory, but I do think, I've talked to people about, finding the island to move to, and I do think there are states that are open to having sort of sanctuary locations. I don't think California is one of them, honestly. I personally wouldn't stay here if I didn't have to. I'm stuck here, but I think there are areas that are less likely to force vaccines within the United States even. I think if you go outside, or if you go outside the lower 48, you could find places that absolutely will not require the vaccine. But so anyway, that's that question answered. The next question. I'm concerned that my health insurance will require COVID vaccine as a prerequisite to continue offering health coverage. Any knowledge about this coming down the pipeline? And if so, what is our recourse? I don't think they can do this while it's under emergency use authorization. And, we are living in a strange world, so don't quote me on any of this. We could be 4 months down the line and all of this is happening. I didn't think we would, well, part of me thought we would be here, but I was hoping we wouldn't be here at this point. My answer is get a health insurance that doesn't require that. There are plenty of health insurance options that do not require, that are much more alternative oriented. Most of them have emergency plans, which basically means your deductible is really large, but your monthly rate is low. Many of them include chiropractic as included in there. So my answer is find a different health insurance if that's the case. Next one. Do you have any recourse if schools begin to mandate the COVID vaccine? So again, the other piece of the COVID vaccine here in California, most states are like this, but some are not. For example, Colorado just requires changes to be made in the regulations. Same with Hawaii. So let me go through law versus regulations. So a law comes into place when the legislature votes on it, it gets signed by the governor, or if there's a ballot initiative and it gets voted on by the people of the state. Those two things make laws. The regulations are what defines the rules that define the laws, and the regulations are created by the entity that the law applies to. So for example, school vaccine laws in California are under the California Public Health Department. I think that's the case for most states, it's the Public Health Department. And so the Public Health Department created the regulations. If you look at the regulations for SB 277 and SB 276, they include things like the conditional entry and the vaccine catch-up schedule. So if your child isn't vaccinated, this is what you have to do in order to get them vaccinated to be in school. Things like that are not in the actual language of the law. It's completely legal, completely allowed. If you don't like, if there's something wrong in the regulations, you can go through a process to try and get it rectified, but it's extremely difficult. So the regulations sort of are the expansion and the explanation of a law. For schools in California to add the COVID vaccine, it would have to be added in one of two ways. It can either be added through the legislature. So if a legislature brings forward a bill, which they can do up until January, February this year, and it will go through, and then it will go into effect either emergency, which is right away, or in January 2022 or beyond that. And it has to pass both sides of the legislature, and it has to be signed by the governor, which in California we know happens way too easily on vaccine issues. But that's one way of it becoming law, or it being added to the school. And with that, it doesn't have to have anything but a medical exemption. So it really depends on how the legislature puts it through. The other way, according to California law, is that CDPH, the California Public Health Department, can add any vaccine they want to the school schedule, but they have to add a personal belief exemption to it. So it not only has a medical exemption, but it has a personal belief exemption attached to it. I can see that happening as well. Again, I don't think it's going to happen for K through daycare and K through 12 schools until we actually have a vaccine. Now, somebody, probably Senator Pan, may preemptively put a bill in this year, but I think there'll be enough pushback that it won't happen this year for schools specifically. So hopefully that answered that question. And the next question, are existing MEs likely to be good for the COVID vaccine? So I assume you're talking daycare K through 12. Possibly is the answer, but possibly not. So for those who have medical exemptions that are grandfathered in, if they have a line that says, and all other vaccines, they may be, but it really depends on if the legislature puts a bill through, and if they do, it's really however the language is in that law, and however it's interpreted by the California Health Department. So the answer is we don't know. Again, if CDPH, if the California Public Health Department adds it to our schedule, there will be a personal belief exemption. They have to add a personal belief exemption. I will say for people that are watching this from other states, most other states, for the states that only have a medical exemption, so Maine, New York, West Virginia, Mississippi, it is likely to fall under the same criteria as your medical exemption is. So the answer is, go look at your own laws and see, you're probably more versed in that than I am. I can speak California law all day long and federal law, but not. Okay, next question. Does the COVID vaccine contain any type of nanochip? Is there a 5G connection with the vaccine? So it's a good question. And the answer is I have no idea. People will say, oh, that's just conspiracy theory about the nanochip. I wouldn't say it's conspiracy theory. So there is either, there are two. There is a nanochip that has been, has a patent to it. There's also a really small, I was reading about it this weekend, that Johns Hopkins came out with something that is the size of a dust particle. It looks like a star. And if you, for example, if you inhaled it, it goes into your intestine and the star sort of scrunches up and administers a drug. Could any of those things, is it a possibility in this day and age? Yes, it is. Do I have any idea whether it is or not? No. Could it be? Yes. Could it be? No. I can't answer that. So am I concerned about that? Yeah, but that's probably not the first reason that I wouldn't get the vaccine. I wouldn't get the vaccine because it's so new, because this has never been tested on anyone. There's probably 100 things on my list of reasons why not to get the vaccine before I even get to that piece of it. So, when people ask me, I don't talk about that because it's, people do consider it conspiracy theory. Is it possible? Yeah, it's possible with the research that's out there. It's public knowledge. But I think there are many other reasons to go for it. Is there a 5G connection with the vaccine? Again, I don't know. I mean, it really depends. None of these contain heavy metals, so possibly not. But I think the 5G issue is an issue. I see it in and of itself. Like, there's many more issues with the 5G than the vaccine. I wouldn't go down that path. I think there are many other reasons not to have 5G than to. So I'm a big believer in trying to be rational in my conversations with people, especially people who haven't done a lot of research. And so to me, when I start going down things that are considered by mainstream conspiracy theory, it doesn't help our cause. I've done a lot of research. I've done a lot of reading. I get all of the pieces of the puzzle, but I just don't see that that's a way to open doors with the people that we need to wake up. There are many, many other reasons before I get there. So hopefully that answered that question. Next one. My husband is a deputy sheriff who works in a jail. How do I go about getting an exemption for him? I'm very concerned his employer will mandate the COVID vaccine as a condition of his employment. We live in California. I know exemptions are pretty non-existent here. So again, I answered that question. Religious exemption is the way to go. If you go to a Voice for Choice advocacy under issues, look for employer choice, and under issues under vaccines, employer choice. If you Google or whatever you use, DuckDuckGo, whatever search engine you use, if you do search engine, a Voice for Choice advocacy and employer choice, it will come up and it goes through on that page all of your options, but it goes through the religious option and religious exemption option. And again, if you need help refining that language, please feel free to email me. I'm happy to help people. Next question. My question is regarding the first EUA emergency use authorization that we were told they could not mandate the COVID vaccine. Now more info is coming out that the EEOC US Equal Employment Opportunity Commission issued guideline last week claiming that requiring a COVID vaccine would not violate the ADA Act of 1990, and that though employers can require certain medical exams like blood tests, the COVID vaccine does not apply. That according to patriothq.org. So I addressed that question. If you read the EEOC statement, they put a statement out, similar statement out for the flu vaccine. You can get a disability accommodation, a medical accommodation, and a religious accommodation. They have to have a religious accommodation. The ADA Act, as I said, the disability really, you have to state why your disability doesn't allow you to get a COVID vaccine. And to me, that's the same as a medical exemption. So those two fall kind of into the same piece, but the religious exemption is the way to go. Next question. What is going to happen to the kids who need medical exemptions from shots? My kid have asthma and eczema and are allergic to some foods. So I am assuming you're in one of the states that does not have anything but a medical exemption. So when you ask your question, if you can put where you're at, that's helpful. But I'm going to assume you're in California or another state that only has medical exemptions. Unfortunately, after this year, if your child is not grandfathered in, your only options are an extremely strict medical exemption that is based on previous anaphylactic, really dire reaction to a vaccine that doesn't cover other vaccines, or to vaccinate, to homeschool, or to move out of state. Those are basically your three options. As of 2021, we really don't have a medical exemption option anymore in California. The one other option or out is if you have an IEP. So an IEP is an individualized education program plan, and that is for special needs children, but your children really have to have special needs and have to be on an IEP. So that answers that question. Next question is, have there been problems with the vaccine exemptions being honored for children going to school? My daughter has an exemption dated 2019 and will be entering high school. I am waiting for her to enroll until I find out if a COVID vaccine will be mandated. But I wonder if exemptions in general are being honored for entering San Francisco high schools. So yes, if you have an exemption and it is grandfathered in, they are being honored. If you have an issue transferring from one school to the next, do get in touch with us. We're happy to help you out. The two criteria where they're not being honored is, number one, if you're in a checkpoint grade this year. So if you, or next year, or whenever you get there, checkpoints are entering preschool daycare for the first time. TK kindergarten, which is the same grade span. So if you enter at TK, you don't get re-examined at kindergarten. Your exemption is good till 7th grade, and 7th grade is the last one. So for high school, if she has a pre-net 2019 exemption, it should be good to go transferring into a high school. Having said that, if your doctor has been put on probation because of medical exemptions, then you're out of luck, and it really depends whether the school looks into it carefully enough or not. I will say that it differs by private school, public school, how much knowledge they have, how much knowledge they don't have. But yes, they are being, from our knowledge, they are being honored. Next question. Hi, Christina. I am a contractor through a temp agency and work for a biotech company. Beginning January 4th, 2021, the company is making the COVID testing mandatory because they believe this is an important safety measure. The company sent a long email and I don't know how to proceed. Please help. The testing issue is one that I have not found a way out of legally. So there are people that have gone to their employers individually and said, I do not feel comfortable with the COVID testing. But if a company requires it, I mean, it's similar. We've had years of different organizations, different types of companies requiring things, you know, whether it be TB testing or Hep B testing or other testing. That COVID testing isn't considered a medical treatment because it's it's basically a test. I will say, two things that I would recommend is there are now saliva tests that are available. You can get them at Costco, you can get them at other places. If your schools, we're seeing schools more and more doing COVID testing, either as a one-time thing coming back after the holidays, and employers too, or as an ongoing thing. If you're subjected to that, I would request that you get a saliva test. The PCR test, it's also a PCR test. PCR tests are riddled with issues. So, don't get me wrong, I'm not saying that the testing is right, but from a legal perspective, I have not found any way. And, people have come out with, I know Peggy Hall came out with something saying there's a way you can, say no. You can try and say no, but you risk losing your job. I mean, or you risk not being able to do your job. So, and can they fire you for that? Yeah, they can. I mean, it's a policy they've put in place. You can say, well, would you be required to wear a knee brace? Well, a knee brace doesn't fall under public health. So, this is a public health measure. Can they require it in a pandemic? Yes. I'm anything that I say, I'm not saying that I agree that, where we're at with all of this is the right place to be at, but I'm talking about logistics and how to get around them. But the saliva test is what I would recommend, because then you're spitting into something rather than getting something shoved up your nose or put in your mouth. Again, there are questions of what is being shoved up your nose. The other thing that I would say is if you get a positive test, go immediately and get retested, because the amount of false positives out there is high. So, I wouldn't trust the test. If it says, yes, you're positive, I wouldn't trust it. I would go and get retested immediately. A side story, Elon Musk had 4 tests in one session. It was one was positive, one was negative, one was positive, one was negative. So there's clearly an issue with the tests. But that's what my 2 recommendations, I don't see a way around it, but my 2 recommendations is ask for a saliva test and ask for a retest if you do come back positive. Next question. What are the crucial differences between the various COVID vaccines? Are some less hazardous than others? Good question. So there are literally 200 COVID vaccines in development. We have 2 that are emergency use authorized. Both of those are mRNA vaccines, messenger RNA vaccines. They use replication and DNA or RNA in them. Both of those are novel technologies. They have never been tested on humans or fully approved by the FDA. They've had some testing done, but they've never been fully approved by the FDA. They still aren't fully approved by the FDA. They've never gone the full way through phase 3 clinical trials. So those are experimental. The next one that's likely to get emergency use authorization is the AstraZeneca Oxford vaccine. That is an adenovirus vector vaccine. Again, that is brand new technology. It has not been used before. It's experimental. So the fourth one that I think will get emergency use authorization in the first few months in 2021 is a J&J vaccine, and it is based on an existing vaccine protocol. It does include aborted fetal cells, so that's something to consider, but it is based off of existing technology that has been approved. And so, you know, when people ask me which one should I go for, my answer is I wouldn't go for any of them in the first 6 months or in the first year, because they haven't gone through clinical trials. So you are part of the experiment if you're willing to, you know, if you're going to get the vaccine before they've gone through clinical trials. But I would certainly wait until there are at least 4 on the market and people have seen what the you know, what the reactions are. We've seen with the Pfizer vaccine, there have been a number of reactions of healthcare workers that have had some form of anaphylactic shock, fainting, you know, all sorts of reactions. I was reading that through the VSafe, which is the vaccine safety program, or where they follow people who've gotten the vaccine, over 3,000 people have had an issue, which is 1 in 35, and that issue is bad enough that they cannot continue with their daily activities. So it's a serious reaction. So my recommendation to people is, if you really want the vaccine, why go for the first vaccine? The first vaccine was the most rushed vaccine, and so why go with that vaccine? But I would wait. But out of the 4, if you're asking the most okay, I would go with probably the J&J one, because it's at least, you know, based off of vaccine technology that has been out there before. But I still don't have faith in it at this point, because the clinical trials haven't finished. All right, that question's answered. Next one. They say that there will be mandatory COVID vaccines for travel, license renewal, professional license renewal, etc. So if we can use a religious exemption for work, will a religious exemption work for those kinds of activities? I don't know. So the employment one falls under the Civil Rights Act. I believe that we need to make a case. Basically, the answer is it hasn't been brought before the courts, and I think we need to make the case. The school level vaccines, that has been brought before the court, and before the Supreme Court, and they said no, religious exemptions are not allowable. The police power rules. The answer is I don't know. I think in the next year, it will be very hard to enforce a vaccine, especially when they're not available to everyone. Once they become available to everyone, it may be different. But I think there will be a medical exemption. As for the religious exemption, I think we have to see how it plays out. And I think we have to, you know, I think it is a place where the more people know about it, the more it will be expected. But, you know, other countries don't have the same religious freedoms that we have. So when you say travel, you know, maybe within the US, you can travel with a religious exemption if that's, you know, if that's allowable. But international travel, you may not. So that's, you know, I don't have an answer for that at this point. It's a developing situation. Next question. Do you know of anything that is happening with the mandated flu shot by UC schools? Any other lawsuits or pushback? Do you think this is just paving the road for a mandated COVID vaccine shot? So the UC schools have a religious exemption for both. We actually got that, a group, and we don't know who got it, but a group of us, organizations and the unions were working together, as well as the lawsuit that was there. I actually wouldn't advise another lawsuit on this issue. Because you have the religious exemption for UC schools. I think, to me, the lawsuit was a question mark, because it could have taken away the religious exemption for everyone, for all employees. Thankfully, it didn't. But clearly, if you listen to the hearing, the judge was very much for vaccines and thought this was frivolous to even try to not have the flu shot be mandated at USC schools. And from my experience, that is the case, especially in California. The legal system is not favorable to questioning vaccines or questioning public health. So UC schools have a religious exemption for both faculty, staff, and students, and I think the same will be available for the COVID shot. I do think they will require the COVID shot for anyone coming onto campus. The other issue there is other schools, so other universities and colleges don't necessarily have the religious exemption for students. They have to have it for staff and faculty, but they don't have it for students. We have been successful in getting it for students at Sutton colleges and universities because we have claimed it's discrimination to have it available for your staff and faculty and not for your students. So if you have a college that's not at UC, but if you have a college or university that's requiring the flu vaccine for students and staff or staff, get in touch with me. We're happy to get there. So that one's that answered. Next question. Are there any true benefits to the vaccine? I'm not planning on taking it, but my mother is very high risk for COVID. She's 79 and on kidney dialysis and is trying to weigh the risks versus the benefits of taking the vaccine. Good question. My first answer is nobody who's on kidney dialysis has ever had this vaccine. So who knows what it could do to her system? The question is, a voice for choice stands for informed choice, right? Informed consent and transparency. So what you need to do, and to me, the vaccine issue is a very personal issue. There is no blanket answer to this. You have to look at your mother, in this case, she's 79 and on kidney dialysis. You need to look at what are her risks of getting COVID? Is she in a high risk area? So the chance of getting COVID in the US is 1%, less than 1% today, even as numbers are spiking. And the reason for that is, you take California, we have, however many cases, and only 5% of those cases are positive at the moment, 5, 6, 7%, whatever the number is today. But that's of the people who have tested. So not everyone has tested in the state. And so of the people that have tested recently, there are, millions in California and in other states that have not been tested, who don't have COVID. And so the number of people that actually have COVID in the US at this very moment is less than 1%. So the likelihood of her getting COVID, I'm guessing if she's 79 and on kidney dialysis, she's not out and about in big gatherings. She's not doing things that are at high risk. The one high risk thing she may be is going into a hospital or into an emergent, an urgent care place. So, you have to weigh the risks and the benefits. So what is the risk of her getting COVID? Period. Just getting COVID, not what happens to her after she gets COVID, but what's the risk of her getting COVID? Then take it, okay, of that risk of getting COVID, what happens to her if she gets COVID? So, and this is, I'm talking specifically to this issue, but this is everyone. What happens to getting COVID? Is she taking vitamin D? Is she taking vitamin C? Is she taking zinc? Is her immune system, other than being on kidney dialysis, is she a healthy person or is she a sick person? Is COVID going to kill her or not if she gets it? Even among high risk people, COVID, they don't die, 94% don't die from COVID. So it's, it's really looking at that versus the risk of the vaccine. And the risk of the vaccine is a much bigger unknown at this point than COVID. So looking at that, and no one above 85 has been in the clinical trials. She's 79, but no one over 85 has. No one that is has serious health issues has been in the COVID trials. No one that's on multiple medications has been in the COVID trials. So there's really no data there. So the question is, and the COVID vaccine and all other vaccines have not been tested for infertility, for cancer, or for mutagenicity. And the mutagenicity on these two RNA vaccines are, that's what they do. They replicate the RNA. So they're doing something. Do we know what they're doing? No, we don't. So my answer is every single person that is considering taking the vaccine needs to think about the risks of the vaccine, the benefits of the vaccine, the risks of the disease, and the benefits of the disease. Or, and when I say the benefits, I mean, there are benefits to getting COVID, which is that you are immune for a certain period of time. You're not going to get it again. those are the pieces of information. As I said before, the one big question that I ask people who are going to get this vaccine in the next 6 to 12 months is, would you have gone to be in the clinical trials? If the answer is yes, do your research and possibly get the vaccine. But if the answer is no, you wouldn't sign up for the clinical trials, why on earth are you getting the vaccine or considering getting the vaccine? Next question. I am a chiropractor and I work part-time in a nonprofit clinic. If this RNA virus does not stop transmission, I think you mean the mRNA vaccine, does not stop transmission of the virus, getting it or giving it, then how am I a risk to those I serve? She is most concerned about the prenatal patients because that is my specialty, and I know there are no studies in the prenatals are not cleared for the vaccine yet. I hope never. That's crazy, especially with this talk about it causing infertility. Actually, the prenatal patients, if you are pregnant or breastfeeding, while you have not been in the clinical trials at all, you are offered the vaccine when you are in your priority group. So for example, healthcare workers who are pregnant or breastfeeding can get the COVID vaccine at this point. That's crazy to me as well, but they can. They haven't been studied. They will be studied as they go along. You're right. It doesn't help you or the people that you serve, because if you get the vaccine, you can still, we believe, you can. There's no clear data, but both BioNTech, Pfizer, and Moderna both say that there's a possibility that you can still transmit the disease. So it doesn't make that much of a difference if you get the vaccine or not. If your patients get the vaccine, it's supposed to have them not get the symptoms or get as serious a case. Now, it doesn't stop extremely serious cases. So if you have an extreme viral load, then that's an issue. So I think that's the answer. Is there isn't clear data that shows that you not getting the vaccine, that you will put those patients at any less or more risk than if you have the vaccine. That's a question. Why hasn't ACLU started some legal action against the forced speed of the vaccine's release, minus long-term testing? Anyone else contemplating legal actions? So the ACLU, we found in California and elsewhere, has an aversion, as many people do, to anything that has the word vaccine in. So it becomes toxic. So they don't see this as a huge issue. I think, when you come to public health issues, it's very hard to get civil liberties people on board that are large organizations. The legal action, it's hard. I mean, I also would say, legal action are, it's a very biased system. You would hope that the legal side of things would respond in a better, more unbiased way. But with the word vaccine, I have found that is not the case. I think, especially because it's under emergency use authorization. So, there are many, many caveats that definition has. And so under that definition, not that I believe anyone's getting the full informed consent, being given informed consent to get these vaccines. But I think that it is, but because there is that caveat, it sort of becomes a non-issue. Next question. Is there any effect on fertility? Does the messenger RNA have any effect on DNA? I spoke a little bit to fertility before. We don't know the answer to fertility. Of all the vaccines, the messenger RNA vaccines are the ones that I would have most issue with if you're pregnant or considering getting pregnant or dealing with fertility, because they replicate. But no vaccine, 0 vaccines have been tested on humans for fertility issues. If you go to section 13.1 in every vaccine package insert, it states that there have been no studies done on humans for fertility. Some have mice studies, but nothing beyond that. So the answer is we don't know, and any vaccine has that issue. Does the messenger RNA have any effect on DNA? So there's the 2 companies that have the mRNA vaccines say no. But again, you know, these haven't been tested on people long term. So I don't think you can say, I don't think anyone can say at this point whether it does or it doesn't. If they are saying yes or no, don't believe them, is my answer. Okay, next question. Can we as adults get letters stating that we will not accept any vaccinations legally and that we will not legally follow any socially mandated orders that we don't believe in or will accept? Yeah, sure, you can write that letter. Whether anybody listens to you is, if they want to enforce it, they can enforce it. I mean, we've seen that with mosques, right? We've seen, you can't walk into a store without them. Well, you can try, and you either get stopped at the door, depending, and this depends very much on which state you're in, but I'm talking California, where we live under a much more rulership than other places. But so you can write whatever you want, whether if you're trying to get into a store or into into something else, it's not really going to help you in my perspective. Next question. How do I get exemptions for all my children not to receive any vaccine of any kind and still be able to go to school? So if you are in California or one of the other states, as I said, it's extremely difficult to do that. You need to either have, again, I'll go through it, you either need to homeschool, vaccinate, move out of state, or have an IEP, which is a special needs, if your child is special needs. But in California, it's incredibly difficult, and in the other states that only have medical exemptions, it's incredibly difficult. In every other state, there's a religious or personal belief exemption option. Okay, next question. Have you heard the interview with Dr. Christine Northrup about nanoparticles and the vaccines that are designed to track our every move? Is this different than the microchip that many talk about? And is the nanoparticle true as far as you know? Again, I answered this. It is what I call a microchip. It's the same thing, or it's the same difference kind of thing. And is it possible? Yes, it's possible. Is it happening? And I can't tell you the answer to that because I don't know that. Next question. Does the COVID vaccine have any effect on cognition and mental ability? I don't know. I don't have the answer to that. It clearly, some people have reactions to it. What those long-term effects are, we can't tell at this point, and it's something to watch out for. Okay, next question. How are medical mandates legally enforced? And what do you know about the state of emergency only lasting a maximum of 120 days? So medical mandates are legally enforced because it's in our laws. Different states have different laws. For example, here in California in 2019, AB 262 was put through, and that allows the health officer to take any action they deem necessary to deal with an epidemic. Epidemic is more than 3 people that have it, or even if there's an imminent risk of an epidemic, which there is always because we have plane travel, although right now we don't have plane travel, but you get what I mean. So it really depends on your state and your state laws. But do they have the right to do it? Yeah, according to California law, yes, they do. What do you know about a state emergency? Oh, lasting more than a maximum of 120 days. So in California, in other states, there is a maximum of 120 days, and after that, the legislature has to put it through. In California, our governor can extend that as many times as he wants, and that is legal in California. Next question. How many deaths have been reported from each of the current top contending COVID vaccines? So 0 deaths have been reported from the vaccine arm. So there's been placebo deaths in the placebo arm, but there have not been deaths in the vaccine arms or among people who have gotten the emergency use authorization vaccines. Those are reported deaths. Whether there have been other deaths, we are not told. So as far as I know, there are none. But I have heard, there are people that are saying that there have been some. I have not known that. Did I say that vaccinated people can still spread COVID? Yes, that is the thought. That both companies with emergency use authorizations have said that they believe that transmission is still possible. This isn't a new thing. It happens with the pertussis vaccine. So pertussis whooping cough. It happens with that vaccine. You can get pertussis, have it sitting in your throat, spread it, and you don't show any symptoms, but you can continue to spread it. And that's well known in the medical industry, the pharmaceutical industry understands that and knows that. Okay, next question. As of now, what state would be the best place to move for medical freedom and where they won't mandate vaccines, including COVID? Also, what other countries in the world are the top countries for medical freedom? Interesting question. I have thought a lot about this. My answer is, if you're moving within the United States, so they're within the lower 48 states, or Hawaii or Alaska, so not Puerto Rico or the Marianas Islands. They are, I would say, you want to look for specifically, and I hate to say that this is politicized, but it is politicized, and it just is the way. You do not want to go to a state that is Democrat in all three parts of their legislature. So when I say three parts, there are two houses here in California. It's the Senate and the Assembly and the governor. If you have a trifecta Democrat, forget it. Those are the ones that mandate vaccines. You want to go to a purple state, and you want to go to one that has at least two out of the three being Republican, because Republicans are just more for smaller government and parental rights. I will also say, though, I would look at which states have had vaccine legislation in the last 5 years. So NVIC, the National Vaccine Information Center, Advocacy, on their website, amazing website to track all the legislation in every state. But you can go in there and look at which states have had legislation. So Arizona, for example, good state, purple state. They're going a little bit blue because of the Californians that are moving there. But they have had a lot of legislation, both trying to get rid of the religious exemption, but they've also had positive legislation. So they've had legislation to try and be more proactive on, showing the vaccine ingredients and stuff like that. To me, you have to work out whether you want to go to a state like that, because you will be fighting vaccine legislation. I wouldn't go to a place like Colorado. I mean, they, for 2 years in a row, have had vaccine legislation. They beat it, but you're fighting. You're as you were here in California. I personally would go to a state where you're not fighting it. Some of those are South Dakota. I think Texas isn't. A lot of people are moving to Texas and Idaho, which for now are okay states to move to, but with more and more people leaving California to go to those states, it may very well change in the next few years. I wouldn't go, there are 5 states that only have a medical exemption. Clearly those ones you don't want to go to, but I would research. I mean, the other piece is medical freedom is one thing, where you're willing to go is another thing. South Dakota, I would move there, but not, do you really want to go to South Dakota? It doesn't have much much of other things. So anyway, those are the pieces of the, you have to think about not just, it's cold in South Dakota, there are many other issues that you want to look at. I will say, if you get outside of the United States, so I have a good friend of mine that moved to the Marianas Islands, which are by Guam. Fabulous place, but you have to be willing to live on an island. So, and there it's, the vaccine, I'm pretty sure won't be mandated because they are just much more of a free culture, and they have other cultures, native cultures there. Other countries in the world is really hard right now. I think every country has locked down. I mean, I would say places like Sweden, but I would do your research. I mean, the other question is, do you have the language that you need? Do you have the job do you have the visa? Do you have the, there are so many questions. So I think you have to start by looking at what countries would you consider, and then go through what, what countries are you willing to live in? Okay, next question. How long do you think it will be until airlines require the COVID vaccine? We are planning to go to England in 2021 and wondering if we should go in the next few months rather than put it off until the summer. I think it's a great question, and I would go sooner rather than later. I agree with that. Having said that, England's locked down at the moment, so I would like to go too, but I'm, nothing's open in most of Europe at this point. So I do think there will be airlines that require the vaccine, and I think there will be, like Qantas has said, they will require it. But I also think there will be airlines that won't require it, but recommend it, and you may have to do testing, for example, if you don't have the vaccine. So I think there will be other restrictions. But I also think while it's under emergency use authorization, and while not every country, so the UK and the US are the few countries that actually have authorized the vaccine. Many other countries haven't even got the vaccine or authorized it. And so, you know, for as long as, and there's all the priorities. So until we get to a point where the vaccine is available for everyone in the world, I think it's going to be hard for airlines to put a mandate on the vaccine. I can see them asking for you to be tested first. Right, next question. What do we need to do to make it possible for California to accept philosophical and religious exemptions again? We are working hard. Voice for Choice Advocacy is working hard on this. I think we won't get anywhere before 2023. And the reason I say that is when Senator Pan and Assemblymember Gonzalez get termed out. So they will no longer be in the legislature. And until Senator Pan gets termed out, I don't think we have any chance, because he chairs the health committee. And so any bringing forward a religious or philosophical exemption would be an issue, that he would come before him, and he doesn't even need to hear the bill. So from a legislative process, I don't think we can do it till 2023. A Voice for Choice Advocacy is working heavily on this in the state legislature. For example, last year we had a bill that labeled menstrual products, and we got that all the way through the legislature, and the governor signed it. And the reason why we put that forward, I mean, it falls in our mission statement, but for example, we got to talk to legislators about informed choice, about transparency of labeling, about knowing what goes into your body, my choice. All of these issues under menstrual products. If we had those same conversations with the word vaccine in there, we would have shut doors. And so we're working on talking to legislators about the general issue of informed consent, informed choice. And with that, we hope in 2023 to have legislation brought forward. The other avenue is lawsuits. We had a Voice for Choice Advocacy, actually it was a Voice for Choice that had it, had a lawsuit against SB 277. It was the most beautiful, and I'm biased, but if you read it, it was the most beautifully written lawsuit. We specifically, I went to our lawyers and I said, I want a person who is completely pro-vaccine, believes in public health, to be able to rule on this and rule in our favor. And so we took parental rights. All these three things have all gotten to the Supreme Court and have been ruled on by the Supreme Court. So parental rights, the fact that you have the right to raise your child as you see fit. Bodily autonomy, the right that you have to basically rule what goes into your body, onto your body, and a right to education. And those three things, all three of them have been ruled on in the Supreme Court. We went to court here in California, and our appeals judge could not stop talking about polio. And he basically said, if I rule on this, I'm basically going to allow polio to come back in. Our case had nothing to do with polio. We didn't mention polio once in this whole case. It was literally based on constitutional reasons. And so to me, the legal side of things is not there. Having said that, with the change in the Supreme Court, I do think that we are looking to do a religious exemption lawsuit. We are considering it. I think anybody who brings forward a lawsuit in California or on the vaccine issue has to be really, really careful, and you have to realize that there are long-term ramifications, and they will be used. I mean, we see the 1906 case, Jacobs versus Massachusetts, that still sets precedents everywhere. I think we do have more of a chance. So if we had our case from 2017 this year, I probably would have taken it to the Supreme Court, because I think we have more of a chance. But we don't have that option at this point. But I think anybody considering a lawsuit, I would say talk to me, because we've been through it and it's not easy. And you have to realize that you could make it a lot worse by moving forward with a lawsuit. Next question. Thanks for doing this, Christina. Are there any plans for Voice for Choice Advocacy to help with legislation for safe tech in schools? Students and staff are being unknowingly radiated at high levels in the classroom from wireless devices and wireless routers. Parents should be able to make an informed consent regarding radiation by iPads, classroom computers, etc. Wonderful question. It is one of the bills that we are shopping this year. I don't think it's going to be picked up. I don't know if any of our bills that are going to, we have 3 bills that we're looking to get authors on. I don't know that any one of them will be accepted because the legislature is only allowing 12 bills this year, which is great. I've always wanted them. In California, you can have up to 40 bills per legislature per year, which means we have about 3,000 bills, which could become law in California every year, which is a crazy number. The fact that we would need to put that many laws in place is maddening. So yes, the answer is yes. We are also, if you're interested in this, I would love to talk to you offline and have you volunteer, because the other option that we're doing, we do for glyphosate. We're also looking to do it with disinfectants, is to do a big push out to the schools and make the schools get the schools educated and get them changing their policies. So I would love for you to email me. My email, I think all of you have it, but Christina@avoiceforchoice.org. If you send that to me, I will happily take your help on that and getting it done. And anyone else who wants to volunteer, we have a million projects that we could use help with. And so if you want to volunteer, please do send an email and I'll get you things. It can be for 2 hours a week, or we have people volunteering for up to 40 hours a week, which is wonderful. Next question. Can grade school children use a religious exemption? They cannot in California. They can in other states. What do you know about this figure? 21% of people getting the COVID vax are getting seriously ill. Don't think it's 21%. It's 1 in 35. So there were 3,000 out of 500, 3,500 having adverse reactions that prevented them from moving, from doing their daily activities to I think there were 500,000 that had been vaccinated. So it's not 21%. But it is, I mean, 1 in 35 is a high number. Is the nurse Tiffany Dover deceased? I have no idea. I saw her faint online. Supposedly there was a picture of her, but the hospital has said she's doing fine. I have no idea. Next question. Do you expect the press to diminish reports of side effects? Are they reliable and not biased either way? Sources for vaccine news. So I think it's hard to find unbiased news in this frame of things. I think the media, the mainstream media, absolutely is pharmaceutical paid. Just watch TV. How many pharmaceutical ads are on TV? Just listen to any other source and look at the amount of advertising that pharma does on mainstream media. I think some reports will be suppressed. I think the V-Safe, which is the vaccine reaction, or basically, let me explain V-Safe. So V-Safe is the program that has been put in place. If you get the vaccine, you're asked to opt into V-Safe. And for the first 7 days, you're sent a text with a survey that asks you how your health is doing, if you've had any reactions, if you experienced anything. Then it goes to weekly, then it goes to monthly, and you're tracked for a whole year. You have to opt in, you have to respond, but you can be followed for up to a year, which is why it's exactly like getting a clinical trial, this vaccine, any of the vaccines right now that are under emergency use authorization. That V-Safe program, I am hoping that the CDC will make that data available to basically open source. They have said they will be transparent. I think we could get it via a FOIA request, which is a Information Act request. But I hope that is. I mean, thus far they've been transparent with it. So I am hoping. I don't have complete faith in it, but I'm hoping that they will that we will be able to see the side effects. Next question. Can you explain how to avoid the new law on kids going into school, elementary, middle, if an ME does it have to be an exemption for each vaccine? specific one or ME for all. Also, please confirm ME needs done the same year as the kids go into the next grade level of school and not grandfathered anymore. So yes, if your child is going into a checkpoint year, this year 2020 or beyond, you need a medical exemption. There will be, starting January, there will be a new form, and it's going to be completely different. So your any grandfathered exemption that you have will not apply if you hit a checkpoint. So again, the checkpoints are preschool, daycare, first time school, TKK, or one grade span. So if you go one checkpoint, if you go into TK, you won't need to be checked at kindergarten and at 7th grade. There will be a form. We haven't seen it because they haven't released it, but as of January 1st, 2021, there is going to be a form. The way that it's going to work is you have to go to your doctor. The doctor has to fill out the form, and the doctor puts it into the immunization registry. And then you get a confirmation that you take to your school, and the school can check the immunization registry that it has been input there. And yes, that does need to be done the same year. So if your kid's going into 7th grade, it needs to be done the year the child is going into 7th grade, not before that. Are there any pros for taking the Pfizer vaccine over any other vaccine, I assume you mean? I don't see any. I mean, I think the Pfizer vaccine and the Moderna vaccine are similar. They're different. The Pfizer vaccine, the biggest difference is the Pfizer vaccine has to be kept at -70 degrees. The Moderna vaccine has to be kept at regular freezer temperature. So from a temperature perspective, there's a difference. But from somebody taking the Pfizer vaccine, it's an mRNA vaccine. As I said, it's novel technology. Whether you want to take that, that's up to you. Next one. Hi, I'm in San Diego. I'm looking for a medical freedom attorney. My son's dad wants our son fully vaccinated. He has a few, but he is being denied in-person school, even though he has an ME. His dad will not look at the risks associated with vaccines and is not pleased our son has an ME. My current attorney sees no risks with vaccines and therefore thinks I have a losing case. Court is in January 2020. I assume you mean 2021, and I'm able to have witnesses. I'm at a loss. Do you have any advice to an attorney to recommend, etc., that can support me in court? His dad's big issue is school. My big issue is my son's health and safety. I'm not a Mosques fan either. Okay, so this is a whole nother issue. And I will say, for those of you that are still watching, I'm going to plan on doing more of these because there is huge interest in these. And I probably in the future won't just take, because we have another 78 questions, which I know I'm not going to get to in the next 45 minutes. But I will do more general questions, but I'll also probably just focus in on certain topics in future sessions like this. But I'm definitely open to doing more sessions like this because I feel people want them. Okay, so the family court issue is a horrible place to be with vaccines. I have been there personally. I will disclose that I lost decision-making on the vaccine issue. So if I can lose decision-making on the vaccine issue, anyone can lose decision-making on the vaccine issue in family court. And I say that because family court is not, it's probably the worst place for vaccine issues. I would say if there's any way of staying out of court, stay out of court. I understand this person, you're in court, so you're not there. I will say I am happy to speak with you offline about my thoughts. You don't say how old your son is. That makes a huge difference. I'm also questioning why your medical exemption has been denied by the school. So that would be my next line of questioning for you. Both of those I would speak to first, but I can help you with attorneys, but the attorneys aren't necessarily what you need. What you need is if you're able to get a long cause hearing and you're able to have experts, that is the ideal thing. If you're in that position, then contact me directly because I can give you the experts and I can give you the attorney that can depose the other side's experts. And both of those things are critical. I think if you are not able to get your kid in school, and vaccines are the issue, you are likely in a losing case because it's something that the court the court wants kids to be in school, especially if there's precedence that they've been in school. If your kid's been homeschooled all their life, then that's a different story. It's a really tricky issue. So my answer to you is send me an email and I'm happy to help you one-on-one. Similar to the religious exemption, every case is different and it really depends on where you're at, what you've gone through, how old your child is, why their medical exemption is not, is not valid, who the doctor was that wrote the medical exemption, whether you can have expert witnesses, all of those things. So get in touch with me. Next question. Our kids, oops, 1 second, jumped on me. If our kids are forced to be vaccinated, any vaccine, not just COVID, do you have any resources for pre and post detox? Yes, so Blaylock's protocol is the one that I would recommend. I'm not a doctor, I'm not a health professional. There are detox programs. There are also doctors, alternative doctors, that will put a detox program specifically for your child in place. So, those alternative doctors may have detox programs, but the most well-known one is Russell Blaylock. If you look up Blaylock vaccine detox program, he has a protocol. Next question. Judy Mikovits said something about the reason bodies are being cremated is to destroy the evidence and make it impossible for future research on our current situation, re cause of death. Possibly. I think cremation has been part of our society for a long time, so I'm not sure that that's exactly all the answers. I also am not sure that they would dig up bodies but maybe they would. So I think possibly. I think there's enough blood and other samples that are going to be around for a long, long time that could be used. For example, we know that COVID was around in December because of people who donated blood from back in December. So I think there are other places. Could she be right? Yeah, it's honestly, it's something that I have not looked into that much because I only have so much brain capacity. Next question. Is there an incentive for Gates and his partners to continue the COVID problem to benefit from their investments? My answer is yes. Go look at the World Economic Forum. If you go to weforum.com.org, search World Economic Forum, the whole plan is laid out there. So yes, there is. Yes. However, I believe Javier Becerra is big on trying anti-religious. He's fought many of Trump's bills. I do believe the Biden campaign will try to make things less religious than during Trump. I mean, that always happens, Democrats versus Republicans. Given where the Supreme Court's at, I have faith that we will continue to have faith. And I think it is the Supreme Court, regardless of what you think of it, I think it is good to have a juxtaposition against the current administration so that there is some form of balance. I believe that on both sides. Next question. Why is this vaccine not recommended for children under 15? It's not recommended because they haven't done the clinical trials on them. So no vaccine trials, no children under 15 have been vaccinated with the vaccine in clinical trials. So there's no research or data on it. Pfizer is the only vaccine that has 16, 17-year-olds in their research studies. So the Pfizer vaccine is the only vaccine that those children, those 16, 17-year-olds could get. Any legal recourse against required PCR tests for flying? Go back to my very first question, or one of the first questions on PCR tests. I don't believe there is. In your opinion, is it possible to not be able to fly if you won't have the COVID vaccine? I answered that. I think for now, no. You can do it without, and when the COVID vaccine is widespread, and available to everyone and has been approved in all countries, I think it may be a different story. Can you opt for a religious exemption if you ended up taking vaccines previously? Is there a way to find the ingredients of the COVID vaccine to be able to opt out through religious exemption? Yes, you can get a religious exemption at any time. Your religious beliefs can have become more sincere. The key is that you have sincere religious beliefs, not personal beliefs, not moral beliefs, not ethical beliefs. Just religious beliefs. Religion, you can look at the definition, it can be spiritual, but it basically is that there is some form of a higher power that you believe in. Next question. Have you heard of DIVOC Diagnostics serological antibody test. Is it sufficient to confirm positive and negative health status? Is there a basis asking an institution to use that instead of the PCR test? I have not heard of that serological test. Usually serological tests are much more expensive. And I don't know, you said antibody test. So an antibody test is different from the PCR test. So the PCR test checks if you are actively, or supposedly, there are lots of false positives, so it's not necessarily accurate, but what it's supposed to do is, and there's issues whether PCR tests should even be used for viruses. So that's a whole different topic. But if you believe the PCR test does what it's supposed to do, it tests whether you have active COVID. The antibody test tests whether you've had COVID and you have created antibodies for it. Now, the antibody tests are not necessarily accurate that if you don't have antibody tests that you don't have immunity, because there's a thing called T-cell immunity. There are no T-cell immunity tests on the market currently. Now, there are vaccine manufacturers that are using T-cell tests because they're showing, they're giving data on that. But they are not, T-cell antibody tests are not available at this time. So even with the antibody test, I know people who have had active COVID, like been sick with COVID, tested positive to COVID, and then after a certain period of time, 3 months, 6 months, they don't show antibodies. And so that may be also an issue with the test, because none of these tests, again, have been properly tested. They're not FDA approved. They're approved under emergency use authorization, which means that the manufacturer thinks they do what they do, but they haven't done any full testing on them. Next one. Is anyone bringing up the Nuremberg Code? So the Nuremberg Code is a good one, except for the fact that the US, it never got ratified here, and it's not within any state constitution. There are pieces of it, human rights pieces, but it's really not something that you can take, for example, to a court of law and base your case on the Nuremberg Code. Next question. How do you feel about companies that say they won't mandate the vaccine, but anyone going into the office will have to be vaccinated to keep the place safe for everyone? Not mandating, but in reality mandating. I've heard that most Silicon Valley companies are taking this approach as part of their reboarding process. Again, they have to offer, so go back and listen to the beginning of this, but the key pieces are they have to offer a religious exemption. As long as it's emergency use authorized, I don't think they can really mandate it. And the other thing, I would educate them on the fact that you can still transmit COVID even after you've been vaccinated. You can still get this, you don't get the symptoms, but you can still give COVID to others. So at what risk are you? Now, they may require you to wear masks although they're requiring everyone who gets, that's why they're saying even after you get vaccinated, you still have to wear a mask. It's crazy. After you get vaccinated, usually you don't, you put your guard down. You don't worry about the disease. Anyway, that's question done. Next question. Is it true these COVID vaccines contain PEG and that many are having a reaction to the PEG? Yes. So they do include PEG. I can't remember what PEG stands for, but it's an antifreeze. They do, the Moderna and the Pfizer vaccine both include that antifreeze. And yes, it is thought that that is what the reaction is towards. If a child's pediatrician gets investigated and you move to another state, would this child's ME still be good in other states? Probably not, but not for that reason. Most states say that you have to, like California, you have to have a medical exemption from a California licensed physician, MD or DO. Most other states that have medical exemptions have that same requirement, so it wouldn't be valid for that reason. The other thing, if you're moving to a state that has a religious or personal belief exemption, I would go with that, because you don't really want your child's medical issues in their school file. It's supposed to be private, but we know that things go further. Okay, next question. 2 questions here. Since the online registry starts in January, will schools lose the ability to ignore details of a student's physical yellow card in the way they can now, because the health department can check the child's enrollment against the registry records? And how will existing yellow cards be uploaded to the new registry? So the registry is not new. the California Immunization Registry has been around for years. Your child, if they have been vaccinated, most likely has their data in the registry if your doctor used the registry. If you went to a pharmacy, for example, that it would have been uploaded. Now, if your child's information is not uploaded, it's not in there and it's on the yellow card, there are schools that will upload your information for you. When you get the yellow card, they'll input it into the registry. They're allowed to do that. There's not much you can do for doing that. The one thing that you can do is you can go into the California Immunization Registry and lock your child's records. And what that means, it doesn't remove the records that are in the registry. All it does is that if somebody requests the information, for example, if your school requests the information, that they cannot download it. It will say, you know, this person's information is locked. You need to go to them to look at it. But there are entities such as the Public Health Department, the California Public Health Department, that can go in and see even your locked records. They're not allowed to use them, but they can see that they're there. So that's the yellow card is useful, but in the next few years, children who have been vaccinated in the last, I would say 5 to 8 years, most likely their vaccination records are in there already. Okay, next question. Can anaphylactic be the reason to say no to a vaccine? I had an anaphylactic reaction randomly a few years ago. I heard if you have anaphylactic allergies to not take the vaccine. So yes, at this point, that would be a reason. If you have documented proof that you've had anaphylactic shock, that would be a medical reason that I would think a doctor, even a mainstream doctor for the COVID vaccine, would say, yes, I'll give you a medical exemption. How long does the emergency use authorization period last? So it either lasts until the vaccination becomes FDA approved. So they can file for FDA approval and get FDA approval. At that point, the emergency use authorization is removed, or until the emergency use authorization expires. So there is an expiry date on all emergency use authorizations. When that expiry date comes up, the company can reapply for emergency use authorization. So a lot of the PCR tests are only authorized for, say, 3 months, and they've resubmitted their authorization and gotten emergency use authorization again. So it's ongoing is the answer, but it flips to FDA approval, then the emergency use authorization goes away. Is it possible for the COVID vaccine could be administered without permission? Hospital patient under anesthesia, child unsupervised in school. So children at this point, no, because the children haven't been tested. There's no emergency use authorization. There's no authorization for any COVID vaccine for children. The key with hospital patients under anesthesia, so the key there is the word biologics. So you want to, when you get into a hospital or an emergent care situation, they give you this huge long thing to sign, and most people don't read it. My answer to you is spend the time reading it. Now, clearly, if you come in and, in a true emergency and you're not with it, you can't do that. But for if you are awake and you're able to read those, read it. And the word you're looking for is biologic. So a vaccine is a biologic, and very often in there it says that one of two things: that they can administer biologics as they see fit, or that they can use pharmaceuticals or biologics for off-label reasons. Off-label means that they're not authorized for that use. Those types of things you want to look for, and if they have them, you can cross them out and say, no, I am not okay with you using these. But the word biologics is what you're looking for. They most likely won't say vaccine, but because that makes it too obvious. I really don't think the COVID vaccine that they would administer it, because at this point, because there's such a short supply of them. And if they're that adamant about the vaccine, they want them for themselves over the person on the table. Do all vaccine exemptions have to be submitted into an electronic California state database? And is the parent or doctor submitting it by January 2021? Would a notarized privacy notice with an exemption help what was written in 2019? Are Mary Kelly Sutton's 2019 exemption still valid? Okay, there's a lot of questions there. I answered the database question previously. It's only new exemptions. So new exemptions go into the database. Grandfathered exemptions do not. A privacy notice does help on the grandfathered exemptions, does nothing for the new exemptions because they're going into the database. Dr. Sutton's exemptions are still valid because she has been notified that she has an accusation by the medical board, but they have not taken action on it. So currently, yes, they are still valid. She plans on fighting it, so that means that they will be valid for longer because it's only once she gets, if she gets put on probation that they become invalid. Okay. Will all the people that tested positive for COVID be exempt from getting the vaccine? No. You can go get the vaccine even if you've had COVID. So they're saying if you've had COVID in the last 90 days, you don't have to get COVID testing and you don't have to get the vaccine. But you are able to get the vaccine if you wanted to get the vaccine. Of course, there's been no testing on people who have had COVID and getting the vaccine. What happens if they are exposed to COVID after that? That has not been tested. So the answer is no, you won't. The question becomes, if you have antibodies, will you then be exempt? And even that, they're questioning whether you can be exempt from the vaccine if you show antibodies. Should be able to, because if you have antibodies, that should stop you from getting the disease again. Okay, next question. Is the permanent exemption the same as the grandfathered? My daughter has a permanent exemption from 2017 and entering kindergarten and school is denying entry. No, they are not the same. So what's crazy is you can have a permanent exemption, which is permanent for the rest of your life, but it only lasts until the next checkpoint. So if you're at a kindergarten checkpoint, it is no longer valid, which is crazy, doesn't make sense, but that's the way it is. Next question. Our daughter's school approved her medical exemption and it was placed on file prior to her starting kindergarten. SB 276 became effective prior to her starting kindergarten, but the exemption was in place on file in 2019 when she registered for kindergarten. I have prior writing acceptance of the medical exemption by our school, but they are retracting it as of last week, more than a year later. She's grandfathered into 6th grade. Do we have a good case to challenge this? You do not. This is one thing that we have Voice for Choice Advocacy, we pushed CDPH on. So prior to August of 2020, the only guidelines were guidelines put out by HHS on SB 276 on the new vaccine law. The only guidelines were put out by HHS, and in HHS, they did not address what happened in 2020. So the kids entering kindergarten and 7th grade this year or preschool for the first time. And so the law is very, very gray. There is nothing that says what should happen this year. There are two interpretations which you can take from that. Either that this year, the pre-2020 exemptions should be accepted because it doesn't say anywhere in there that they shouldn't be accepted. Or that 2020 exemptions, if you're entering a checkpoint this year, you need a new 2020 medical exemption. And they also had in there, so then CDPH put out guidelines in August. And in those guidelines, they specifically said, if your child enters checkpoint this year, you need an exemption dated 2020. They also said, your child can't transfer between schools. And we wrote a letter to CDPH, to the governor. We worked with the governor's office, and they basically said, okay, yes, we agree with you that the governor specifically said, and in passing of SB 276, it was specifically said that children would be grandfathered in until the next checkpoint. So we won that piece of it. There is clear information on the CDPH website, Shots for School, that if you have a vaccine exemption for school and you're within a grade span, if you transfer schools, if you go from, 1st grade to, or if you go from elementary school to middle school, from middle school to high school, and you're within a grade span, that you can transfer, and that's not an issue. The other case that we were arguing was that this year's vaccine exemptions, that 2019 exemption should be allowed to be used, or pre-2020 should be allowed to be used this year, that those exemptions should be, they shouldn't have to have a date of 2020. They should be looked at and reviewed at the checkpoint, but you should be allowed to use a pre-2020 exemption. And CDPH put their foot down and said, nope, that's not the way we read it. We read it that you need a new exemption this year. And so that's what CDPH's guidelines are. That is not written anywhere in the law. Could you have a case? Possibly with the pandemic. I'm not sure you do. I do think there are some schools that are reading the law as it is and saying, well, this is a gray area. We can accept pre-2020 exemptions. And I think both of those, you can interpret the law both ways. CDPH has interpreted it one way, we interpret it a different way. The question is, can you convince your school to interpret it our way? If you can, and there are definitely schools that have looked at it and said, no, there's nothing that says that a pre-2020 exemption is not valid for this year. And we have a number, I haven't, definitely there are schools out there that have read it that way. But I think it's really up to the school. And do you have a case? Possibly, but by the time the lawsuit goes through, you're into next year, and next year you will need a valid exemption. The one thing, if it is being revoked, there is an appeals process, which that would be my next step, is to ask the school how you can appeal that decision, and that at least holds off your child going into being banned from school while the appeals process is going. Now, that appeals process hasn't been set up, so there may be more time that you have, but it is a very gray area, and if you read the law, there is no one answer or another answer. Okay, next question. Do you know if there are any airlines that allow flying without masks for those with medical exemptions? It is becoming harder and harder, and I think if you have a disability or a medical exemption, you can try, but I know most airlines have cracked down and said, don't fly if you're, or don't fly with us if you can't wear a mask. Speaking of masks, I will put a plug in. There is a mask called True 47 company, and a Voice for Choice. If you're interested in this, if enough people are interested, I'll do another order through a Voice for Choice advocacy. But if you go to True 47, they are silver mesh masks, and the one issue, the biggest issue, I have issue with masks, period. But the biggest issue I have with masks is the whole breathing your own breath back in. And these masks, because they're silver mesh, they're silver coated, they actually kill the bacteria and viruses on contact. And so when you're breathing back in, when you have to wear a mask, when you're in a situation where you have to wear a mask, you're actually not breathing back in the crap that you have. They are also lightweight enough that they are breathable enough. Let's put it that way. But they look good. So I would highly recommend them. If people are interested, I'll probably put out to our newsletter, or our email followers. I'll probably put out a bulk order on those coming up. Not that I am advocating masks, but in this day and age where there are situations that you have to wear a mask in order to do things, they are a good mask. Okay. Next question. Is it a violation of informed consent for an employer to mandate masks without warning employees of the dangerous side effects, since there are many dangers associated with it, i.e. breathing in microparticles, off-gassing? So that's what I was talking about, but they don't actually reduce the spread. They can even increase the spread. A violation of informed consent. No, ultimately an employer is a private corporation, and they can put whatever rules in place to work, and it's your choice to work there. It's their choice to employ you, especially in states like California, where you have a no, what's it called? You basically can be hired and fired whenever with no reason. So is it? No. My answer to you is either find a mask like I mentioned, or educate them and say, where, and put it on them. Say, where is the research that shows that there is not, that they're not causing off-gassing or microparticles being breathed in, whereas the research that shows that they're 100% safe and effective. And I would put it on them. But ultimately, you know, from a employer standpoint, they're a private entity. They can require you to do a lot of things, and that's part of your employment. Okay, next question. My daughter, California, has a grandfathered PBE through the academic year 2021-22. The elementary school where her PBE was filed and held closed down permanently in June 2020. For the academic year 2021, so far my daughter has homeschooled with our home filed as a private school. So currently I am in possession of her PBE. Now I want to enroll her in another elementary school for the remainder of her grandfathered time. Do you foresee an issue with the PBE not being honored? Possibly yes, because you've homeschooled. So her PBE wasn't on file anywhere. So it's, and you can say it was on file in your homeschool, but realistically, it didn't have to be on file. I say the same thing with medical exemptions. People ask me if I homeschool my child for this year, when I enter them back in school, will they be, will their grandfather medical exemption be valid? And I think it's up to the school again. I do think it's an issue. It could be an issue, yes. I would definitely do it before, like as soon as possible, basically. But I think you can argue it either way. If you need help and they say, no, it's not valid, I'm happy to help you create the language in a letter to argue it. But could they say she's a new admission, which requires the new medical exemption? Yes. Okay, next question. How can so many otherwise enlightened and intelligent people be so influenced by mainstream media that they are keen for the vaccine and truly believe in social distancing and masks? Is there any effort to publicize what we know, the pitfalls of these, sorry, your question skipped. The pitfalls of these vaccines, something like Weston A. Price talking points. I guess there is no way to break through the major media information blockade. Can I get in legal trouble for sharing contrary information? So the answer is no, you can't get in legal trouble because we have, our First Amendment freedom of speech. How can others, enlightened and intelligent people, be so influenced by mainstream media? Because this is fear. It's all fear-based. And when you operate off fear, I mean, I look at people and I look at people who are willing to take the vaccine, and there are many of them, are willing to take the vaccine. They're basing it on fear, and they're basing it on the belief that the vaccine has fewer risks than the disease. There isn't a way of breaking through mainstream media, and my response is, and this is what I say when people say, what can I do? Is talk to people. Open your mouth and talk to people. This is a wonderful time. I mean, if there's any silver lining in this whole COVID thing, that is that so many people understand the vaccine and are waking up to the vaccine issue than ever before. Our truth movement would never, ever, ever have been able to get this far in so short a time. I mean, we would still be chipping away at it, but it's a wonderful opportunity to speak to people. People are open to understanding and trying to work out what the issue is with vaccines. And so my answer to you is talk to people. And I find that doing it one-on-one is more effective, or one-on small group people is more effective and plants the seed more deeply than if I go out and do, a video or something like that. Those things are very much talking. I find we talk a lot in our echo chamber and don't get outside of that. I think the COVID vaccine and COVID has given us an humongous opportunity. So let's take the opportunity. Next question. If I go around someone that has got the COVID vaccine, will I have a chance of getting the virus? So not unless they've been exposed to COVID. So none of these viruses are live vaccines. None of these vaccines are live virus vaccines. So you wouldn't be able to get COVID from the fact that they've gotten the vaccine, but they still can be a carrier of COVID. So if they've been exposed to COVID, then they can be a carrier of the vaccine. Now, the one issue there is there are symptoms, reactions to the vaccine within the first 48 hours that are very similar to COVID. And I don't believe that they they have the symptoms, but they don't have the virus that they're transmitting. But don't quote me on that because I don't believe that research has been done. Next question. Fauci has said that it will not stop getting the virus and you need to wear a mask and wash your hands, so it's useless. Yep. Address that. Next question. Can people near those who were vaccinated against COVID be exposed to shedding? I don't believe so for the mRNA vaccines. For some of the other vaccines, it may be the case in the future. My question might already be asked. Sorry for the repeat. If not, what is your opinion about the future of homeschooling in California? It has not been answered. Will be scrutinized with mandated vaccination or other limitations. We have to leave school because of alternative vaccination schedule and are now not confident if homeschooling option will be limited for us as well. Another question, if we need to leave the state of California, what are the most friendly alternative vaccines families? I think you mean states. The state question I already answered. Where to move to, I already answered. Homeschooling in California, there's definitely a push on homeschooling from different angles, not necessarily from the vaccine angle. I don't think that they will limit vaccinations or put any quota or mandates on homeschoolers for vaccination because there has to be a legal alternative to education. So you have a right to education, and if you remove homeschooling and put the vaccination issue on it, then you're not left with any, and that would make for a stronger lawsuit against the vaccine issue. So I don't believe that that will be from a vaccination issue. There are other homeschooling, there are always bills against homeschooling because people don't believe that parents should be schooling their kids. And especially this year because more and more parents have decided to homeschool their kids and realize they can do it. Did the placebo groups get a true placebo this time around? Yes and no. The Pfizer vaccine, it is not clear what the placebo was. There were a lot of vaccine reactions in the placebo group or reactions comparable to the vaccine level in the placebo group. But the Pfizer vaccine, I have not been able to. I've emailed Pfizer and asked them what the placebo was, and I cannot find it anywhere. The Moderna vaccine was a saline placebo. The other vaccines that are being tested, I believe one of them, the AstraZeneca, has the meningococcal vaccine as the placebo. And I don't know what J&J has, but my guess is J&J has been in the vaccine research industry, and so they will not be using a placebo. Why are you so brave to fight for us? I don't know, I'm crazy. I'm passionate about this, and you know, I feel that it's something that I can do, and I'm willing to put myself out there. I started this because of my children, but I move on because there are so many children and there's so many people, and I think, you know, we're on the right side of history. You know, I think that's where we have to look at it, and at some point we will look back on this time as a crazy time, that or we'll be completely, you know, taken over by AI, and you, me, and the rest of us will be living on an island somewhere. But yeah, I just think it's, you know, I don't think it's my personality because I don't think I was like this, but I think I do a lot of research, and so I feel passionate about it. But anyway, I don't know that I answered that question, but I do it because I feel that I should do it. You mentioned that the RNA vaccine has a special nanoparticle coating. I didn't mention that, but it does have some nanoparticle coating. Yes, you are correct. What that does, I don't know because we don't have research on these types of vaccines. So, you know, the long-term effects of these have not been studied. Can the COVID vaccine be mandated under emergency ordinance for kids and adults? Again, kids cannot get this vaccine at this point. It can be, so mandated, again, there's a difference between mandated and required. Can it be mandated by states? I think it will be hard to do so. Can it be required by employers? Yes. Go on traveling and whatever. Yes. What if I'm not religious? Is there a church I can join to claim exemption? Actually has nothing to do with a church. You don't have to be part of a church to be religious. That's in our First Amendment. Your religion is your religion and you can't be judged by it. The key piece is, do you have sincere religious beliefs? And that's defined as sincere spiritual beliefs that there is a higher power that is saying that you should not be vaccinated, you should not have toxins in your body, those types of things. Do we know what Senator Pan is up to these days? My guess is he'll have some vaccine legislation. Thankfully, legislators are restricted to 12 bills this year rather than 30, 40, so they can't get up to as much trouble. We are coming up to 9 o'clock. I still have 50 questions that are open here. I am not going to obviously be able to answer all of them. I'm going to keep going, but I will say that I'm going to keep going and answer a few more. But I will say that I will do another of these. I believe I have a transcript of all the questions, and I will go through them and just make sure that there are any other themes, topics that we come to. If your question wasn't answered, if it's a personal question, so for example, if you have an issue specifically with your medical exemption, if you need help with a religious exemption, if you need help with custody in court, if you have any other topics that you want help on, if you want to volunteer, send me an email directly. But if you have not had your question answered, I'm planning on doing this. I probably won't do it next week, but probably the first week in January, I'll do another one of these and we can get to other people's questions. But I'm going to keep going for probably another 10 minutes and just see, answer the questions. Was my child injured by vaccines? No, my children are completely unvaccinated. They are both teenagers, preteens, but I asked the questions. I went down the rabbit hole early. Question, hi, I am a 47-year-old medical assistant taking a medical assistant class, and because I found myself without work after COVID, I'm supposed to show proof of titers for disease or get vaccinated. I can't show proof and I don't want to get vaccinated. I'm told I can only get a medical exemption, but I have no underlying issues. As I said, religious exemption to that one. If someone gets vaccinated in another country, is it still valid in California? Yes, if you have your vaccine records. And if they are not in English, you have to have them translated by an official translator so that it is clear that that they are valid. So what can we do to verify news reports if overrun hospitals contradicting information? So there is hospital information that people are putting out. I do believe they are at capacity when they say they're at capacity, but the definition of that is different from what we're actually, when they say 100% capacity of a hospital, that's different from 100% of the beds being full. And that's the definition of it is where it's different. We've also been at capacity in the past and never shut down, never locked down. So there are, I believe, I also saw that the CDC on their website now has hospital data by hospital. So they updated that. What can we do to, what are your thoughts on alternatives to taking COVID vaccines? So I'm all about food, nutrition, making sure you stay healthy, vitamins, getting rid of all toxins. A wonderful place, I'm going to plug it, a wonderful place to learn about all that is LiveAware, which is an expo that I put on. We've had 3 thus far. If you go to YouTube, our 2 years, and I'm uploading the 2021s, are on there, and there are amazing speakers. We had Chris Exley on there before Chris Exley was known. we created Chris Exley in the US other than CMSRI, but the 2 of us were promoting him well before anyone else knew about him. We had Matt Landon of Frankenskies this last year as our keynote. Judy Mikovits spoke in February about COVID, just that we had in person the last weekend before we got shut down. So definitely check out LiveAware videos. Do I consider 5G toxin and a threat to the COVID vaccine or a threat to biological insects and humans? I do think 5G is an issue. Again, we did a whole load on we had a number of speakers at LiveAware speaking on 5G. So I definitely think 5G is an issue. Mixing it with COVID is controversial. So I keep them separate. I think there are enough issues separately that you can talk to people and get them to understand the issues. Can a health officer vaccinate kids at school without parental consent in California or any other state? The answer is yes in California for sexually transmitted diseases, no otherwise. And there are other states that have that same law or further, but yes, there are other states that have that. Next one, what is PCR test for children? Okay, the safest PCR test that for children, as I said, is a saliva test. There are saliva tests that schools have you can, there's one called Saliva Clear, which schools, basically you just spit into a bottle and they send it off and they get the test results. That's the one that I would recommend. Not that I agree with PCR tests. I think there are way too many false positives. I don't think it should be used for this reason, but if you're going to have to, the Saliva Clear is what I would ask your, or any saliva test is the one that I would ask your school. And if your school is requiring the up the nose one, either the anterior, which is down here, or the one that goes all the way up your nose, you can ask to go get a saliva test as an alternative, and they should allow that. Okay, I'm going to answer 2 more questions, and then the rest of them, I'm going to leave. And can you explain, if you would, how AB 262 in California might have an impact on COVID vaccine rollout? So AB 262 again is it was passed in 2019, and it gives health officers, local health officers, the ability to take any action they deem necessary to counter or to deal with a epidemic, not a pandemic, an epidemic. So an epidemic is 3 people or more. Do I think they have the jurisdiction to mandate COVID vaccines? Possibly. Do I think they will? I don't think they will. I think there would be so much pushback. And I think it would be a good lawsuit to overturn SB 262. So my feeling is, could they? Yes, they can. Would they? At this point, I don't think so, especially under emergency use authorization. I would like to see somebody do that and have a lawsuit against them. But so yeah. How do we find out which doctors are under investigation for exemptions? If you go to the California Medical Board and you type in under the licensing, you type in the name of the doctor, you can see whether they're under investigation, whether they're on probation, all of that stuff. Where can I find research that trial has not been done on COVID-19 vaccine? My RN family just got first dose, and we were told by the doctor monitoring after the vaccine that the trial has been granted safe, and vaccine has been in the making for 30 years. Okay. Just go to the clinical trials. The fact that it's under emergency use authorization. So the FDA has a lot of information. There's clinicaltrials.gov, where you can go and look up the clinical trials. I would, to somebody like that, I would go back and say, please show me that research. Show me that it has been 30 years in the making. Show me that the clinical trials have been finished. What is the fee to help your health crossing a religious exemption? I do that for free, but I ask for donations to a Voice for Choice advocacy. I will say, to the people who are left on here and to the people watching again, that is the one thing that I will say. I do this all for free. I don't charge anything for any of my time. And I do it because I'm passionate. But I would say, if you can give any funds to a Voice for Choice advocacy, please donate. If you go to a voiceforchoiceadvocacy.org, you can click on the donate button and donate any amount, $5, $10, $100. If you can afford more than that, please do give to us. It goes mostly to our lobbyists who help us in Sacramento. It goes to education campaigns. It goes to our legal fees for our lawyers. So I don't take any money. I don't make any money off this. Thankfully, I have a good job that pays for me. But I would say, please do donate to us, because it means that I can do so much more when I can hire people that can, get research done and do things to help us. The other option, if you can't afford a donation, please volunteer your time. We have so many projects that we can use help on, that if you have time to volunteer, and it can be, 2 hours to 10 hours to 40 hours, whatever amount of time you want. The ask that I have is that when you commit to a time, that you promise that you do that. But those are the 2 things. And I think with that, I'll stop this. We do have lots of questions left. As I said, I will do this again. I think clearly there is a need for it. Clearly people are interested in it. And I will put this recording out so people can watch it over again if there's information in here. I know it's sort of all over the place, but we will do this again, and I'm going to plan on doing it on a regular basis. I'll send out, if you have not been a part of our email list, please do go to voiceforchoiceadvocacy.org and sign up on the newsletter. There's a pop-up that comes up when you enter the site, and just sign up there and I will put you on our newsletter. We don't send out a lot of emails, but what we do send out is really important. So thank you so much for spending the evening with me. I hope I got most of the questions answered. It looks like I did. But if you didn't, as I said, we'll be back. And my one request is please donate to A Voice for Choice Advocacy. Thanks so much. Take care.